Hi, welcome to the Indian Nurse YouTube channel. I hope last video related to exam tips and tricks. It is helpful to you all. And today's topic, it is very important in community health nursing sector, community health nursing subject, and mainly dealing with second B.Sc Nursing student, fourth B.Sc Nursing student, first GNM and third GNM, along with that second PBB.Sc students. And new syllabus, first B.Sc also added with this topic. That is many confused topic it is, that is the levels of health care service and levels of disease prevention. It is very important question for you all, 5-mark question, even the first B.Sc to the fourth B.Sc and to the GNM students too. And levels of healthcare setting and levels of disease prevention, it is a different question. Most of the students will do the confusion over here and they used to write the same answers. Please students concentrate over here, and I had said you to do the to read the question twice. So first I'll deal with the levels of healthcare services. Levels of healthcare. So while you are writing, as I said, to write the introduction and the conclusion. Even 5 marks if you are writing, 10 marks if you are writing, it is well and good. 5 marks, it is okay. First I will give the introduction. Healthcare is a multitude of a service rendered to the individual, families or communities by the agent of health services or professional for the purpose of promoting, maintaining, monitoring and restoring the health. Mainly here, the students, you need to concentrate like primary health care, healthcare setting. Here what we are doing is promoting, maintaining, monitoring and restoring the health. These are the main 4 components of community health nursing. Here in the healthcare setting also we are dealing the same. Next one, the healthcare goals of system is health development, that is a process of continuous and progress improvement of health status of a population. Healthcare goal of a system, healthcare, it is a continuous process, it won't stop. Okay, it is a developmental and health status of the population. Here we are concentrating with the health status of the population, and here we are dealing with the individual health. Then to achieve this goal, healthcare services are usually organized at 3 levels. So here you have to concentrate, the healthcare is dealt with the 3 levels, that is a primary, secondary and the tertiary level. So once again I will tell primary, secondary and the tertiary level. Now we will see one by one. First one is a primary health care. So it is also called as an essential health care or health care at doorstep. So when we are getting the disease, first we will go and approach the health care. That is called as a primary health care. So here it will be an primary health center or the sub-center. Whenever we used to get the disease and we will go and seek the doctor or we will go and seek the medical services. So that is called as a primary health care. Here the what and all essential health care what we wanted, it will be provided over here. And at a level of health care, it is close to the people where most of the health problem can be dealt with and resolved. So most of the problem what we have, it is dealt and it will be resolved. Like you are getting the treatment over here and you are getting rid from that disease. Then it provided at village level and through the primary health center and the sub-center to the agency of multi-purpose health worker, village health guide, ASHA worker and trained DIs. So here this level will be provided at a village level either by the primary health care center or by the sub-centers. And who will be giving this care? By who will be health workers, multi-purpose health workers, village health guide, ASHA worker. Do you know the full form of ASHA workers? That is accredited social health activist and trained DIs. So here the primary health care, it is mainly dealt with essential care or care at doorsteps. Next one, secondary care level. So first one in a primary care level, secondary care level, tertiary care level. Primary care level is over. Next one is a secondary care level. The next higher level of care is a secondary or intermediate health care level. At this level, more complex problems are dealing with. So wherever we are not dealing with the primary health care, okay, primary health care setting, so they are giving the reference to the secondary care level, mainly CHC, community health care centers, community health centers, where will be given a first referral. Okay, so first referral unit is CHC, that is a community health center. Care is generally provided in a district hospital or the community center, which is also serves as the first referral level. Curative services are provided at this level. So whatever primary health care or primary health centers are not dealing cases, so they are giving the reference to the CHC, community health centers. So here they are dealing with the disease, mainly curative services they are giving. Next, third one, that is a tertiary level. So in the tertiary level is a more specialized specific facilities and attention of highly specialized health workers. This care is provided by the regional or central level institution. Examples, medical college hospitals. So here they are telling about specialized specific care is given at this level. So primary health centers are not dealing cases will be comes to the CSC, community health center. They are also not dealing the diseases, means it will comes to the higher level, that is a highly specialized health workers will be given, and it is a medical college hospital. All Indian institute, regional hospitalized special hospitals and other apex institutions. So this care will be given. So this is about the levels of care services, healthcare services. So next question, it is not next answer, that is a next question, level of disease prevention. So first one we were seen about the levels of healthcare services, primary, secondary, tertiary care. So here in a levels of disease prevention, primordial prevention, primary prevention, secondary prevention, tertiary prevention. That's what I had said earlier. So this is a confused one. Primary, secondary, tertiary will be there. There is a level of care. Here it is at prevention. So the goal of a medicine is to promote health, prevent illness, restore health, and when it is impaired, and minimize the suffering and the distress. As I said earlier, for the there also same thing. So here also same thing. Promote health, preserve health, restore health, and when it is impaired, to minimize the suffering and the distress. Next, levels of prevention, mainly divided into 4 types, what I said, that is a primordial prevention, primary prevention, secondary prevention, and the tertiary prevention. Primordial prevention, prevention of chronic disease, prevention of the emergency or development of risk factors in countries or population group in which they have not yet appeared. For example, many adult health problems like obesity, hypertension. Okay, so here in the primordial prevention, the disease is not yet appeared. For example, I can give you, and the pandemic situation, the corona will be started at China, but it reached India later. So during that time only, if we have taken a primordial prevention, so we can get rid from that pandemic. So for example, obesity, hypertension, or diabetic mellitus. So as we know, it is there in our family. So what we have to do? We have to start with the screening from the age of 30-35 years. Okay, once in a year, we have to do the screening. So that time we can prevent the disease in a earlier only. So this is about a primordial prevention. So we have to do that like regular exercises, dietary pattern, or lifestyle changes. We have to do that. So that time only we can do the primordial prevention. We know that it is there in our family. So we have to do that. That is a primordial prevention. That disease not yet appeared, but still we are taking the precautions. Next one, the main interventions in the primordial prevention is through individual and mass education. So what in this mainly the interventions are either by the mass education or by the individual. So here you have to remember, in this the disease not yet appeared. Second one, that is a primary prevention. First primordial prevention is over. Second one is a primary prevention. It is defined as action taken prior to the onset of disease, which removes the possibility that a disease will even occur. So they are telling it is defined as a action is taken prior the disease, onset of disease, which removes the possibility that disease will even occur. So primarily we are doing the screening. So disease is there, we are doing the screening, we are taking a care and we are getting rid from that disease. So for example, in cancer also, it is a curable disease when it is in a first stage. So primarily we have to do the prevention. Mode of interventions in primary preventions are health promotion, specific protection. In a health promotion, they are telling it is the process of enabling the people to or control over or to improve the health. The well-known interventions in these areas are health education, environmental modification, nutritional interventions, lifestyle and behavioral changes. So here health, mainly in the primary prevention, health promotion, specific protection will be there. How we can do the health promotion? How we can improve our health? Either by the health education, you have to give the health, okay, or you have to listen to the health education. Second one, environmental modification. Some of the disease because of the environmental. So environmental modification. Nutritional interventions, lifestyle, dietary pattern and the lifestyle behavioral changes. So these are there in the health promotion. Second one is the specific protection. So the currently available interventions are there. Protection from the disease, either from the immunization, use of specific nutrients, protection against the occupational hazards, protection against the accident and avoidance of allergens. So this we have to give the health education to the people, or we have to do the practice. Because of that we are get rid from the disease. So these are the specific protection from some diseases. We know that, okay, for example corona, so there is an immunization, so use of specific nutrients, so that and all for the certain diseases, because of the nutrients only it will be get cured. So that is a thing what they are given over here. So this is about a primary prevention. In the primary prevention they are telling there is a health promotion, specific protection. Next one, secondary prevention. It can be defined as the action which halts the progress of disease at its incipient stage and prevents the complication. So here already disease has been come, disease has there, for example diabetic mellitus. So what we have to do is, your mainly thing is an early diagnosis and we have to get a proper treatment so that we can prevent the complication. So this is about a secondary prevention. It can be defined as the action which halt the progress of disease. Okay, for example disease is there but it will not, if you are taking a secondary prevention, there is no progression of the disease and there is no complication. So your main interventions are early recognizing, early diagnosis and the treatment. Next one is a tertiary prevention. When the disease process is advanced beyond its early stages, it is still possible to accomplish the prevention by what might be called is an tertiary prevention. Here in this tertiary prevention, primordial disease not yet occurred, but we know primary like disease will be there. We have to do the certain modification, health promotion, specific protection. And the secondary, they have to do like disease is there, early diagnosis and the treatment. And the tertiary, the disease will be exaggerated but we can prevent the disabilities. So it includes the disability limitation and the rehabilitation. Here it includes like disease will be reaches to the extent, okay, but still we have hope that there is a disability limitation. For example, because of certain diseases we have to do the amputation and all. So that and all things we can prevent it, and even though rehabilitation. So this is about a tertiary prevention. So this is about a levels of prevention. So this is a very important question for you all for the 5 marks. Even they will ask for the 10 marks also with the clubbing. So today I dealt with 2 questions, that is a levels of healthcare service and levels of disease prevention. I hope you all understood with the video. So as I said, if you are having any queries, you can put it in a comment box And if you want any notes, so you can also put it in a comment box so that I can prepare next video with that next notes. And mainly, like, if you having any subject also, I don't mind, I'll prepare the notes. And here, like, so many students were requested, ma'am, you explain it. So I tried, but I did not went much to explain that because it will take a long video. So make it for the shorter, I had did over here. So I'm winding with this video. Thank you, and if you liked, please like and share it, and with your friends also you can share. And those who are there newcomers, please subscribe the videos. Starting I had put anatomy, physiology, microbiology 2 mark questions I were completed with that. So thank you.